How often do dental problems lead to larger health issues in people?
Great question. So it goes back to the first question that we talked about. The hot topic in the news right now is can periodontal disease, or how the periodontal disease leads into Alzheimer's disease, right? So do you think Alzheimer's disease is a larger health problem?
Absolutely.
Absolutely, right? So about half of the US adults have some kind of a major health issues. Either it is Alzheimer's, or heart problems, or lung problems, or any disease you can think of, pancreas and brain disease and whatever you can think of. So normally this is what I tell my patients. Anytime you have infection in the mouth, so you are thinking, well, you got infection in the mouth, no big deal. But that used to be the case, and we used to not emphasize so much on the importance of how the dental disease or the gum disease affects the rest of the body. But we realize now, just like with the topic we talked about earlier, how the periodontal disease affects your brain and causes Alzheimer's disease. So anytime you have infection in the mouth, the infection just gets right into your carotid and goes into the rest of your body, into your heart, and then pumped into the rest of the body. And you can get heart disease or lung disease, stomach disease, or pancreatic disease, or diabetes, or high blood pressure, or stroke, multiple problems you can get. And it just bottom line, it's imagine you go to a restaurant and you ate some food which was infected or kind of poisonous. Now you ate it, and then your whole body gets poisoned and you feel sick, although you just ate just one portion of food. So imagine the same thing, the poison from the bacteria, the poison from all these problems that you have, the gum disease, that's getting into your system, and it's kind of a slow poison. It just keeps poisoning your body on a regular basis. Although you may not feel the effect of it immediately, at some point you are going to see the effects of it. And I can tell you a story, and you have seen one of the doctors that we are treating. Actually, he's a neurologist who we treated about 4 or 6 weeks ago. He had really infected teeth in the bottom right side. He's a neurologist. He has a very busy life, very busy practice, and he also has diabetes. And whenever he was sent to my practice by his family dentist, and the family dentist did not feel comfortable doing the extraction because he had uncontrolled diabetes. And when the neurologist comes to my practice and he shares with me, hey doc, as you know, life is busy, I'm doing everything I can to control my diabetes. Unfortunately, as you know, stress, I just cannot control, and I'm exercising and I'm dieting and all of that. And as you know, I'm a physician myself, and I completely understand, and I talk to my patients all the time. But stress is something that I can't control. I think it is because of the stress, and I have diabetes, and it's not in control. My HbA1c is a little bit higher. So what do we need to do? So we talked to his physician to get some consultation, whether and how we can manage the case. And then we've talked to the physician. We got everything. We got close to where a safer level we can go do the procedure. And then we finally got the procedure done, the 2 infected teeth out, and we got some bone grafting done to prep him for future implants and everything. And then 3 weeks later, he comes to my office for a follow-up, and then this is the comment that he made. Doc, I just cannot believe my blood sugar came all the way down. Do you think there is a relation between gum disease and my diabetes? And I'm just telling him, Doc, and I'm glad you realized that, and maybe I should take a video of what you just told me. That way I can go explain to all my patients, and a doctor telling me like how diabetes comes under control as soon as you get the gum disease under control. So this is the true story. So anytime you have a problem, and I always talk to my patients, if you have high blood pressure and if you have gum disease, and you may not need that high of a dose of a high blood pressure medication. If you have diabetes, and then if you are taking diabetes medications, you may not be needing that high of a dose of a diabetic medication when you get your gum disease under control. So you don't want to have the gum disease lead into larger health problems like heart disease, diabetes, Alzheimer's. You don't even want to think about these in your life, and if you want to do that, then if you want to lead a healthy lifestyle and you don't want to even think about these larger health problems, get your teeth checked. Go to your dentist on a regular basis. I get my teeth cleaned every 6 weeks, so get your teeth cleaned at least every 3 months. Even if you have healthy teeth, it does not hurt to get cleanings done on a frequent basis. Get your teeth cleaned every 3 months. Go to your dentist, brush and floss your teeth, and whatever oral hygiene tools that you can think of. Walk down the aisle at your departmental store and pick up a bunch of tools and pick the ones that you like and keep your mouth healthy. That way you don't have to worry about these larger health problems. Does that make sense, Reese?
That makes perfect sense.
Fantastic. Thank you.
Yeah, if you want to be healthy, keep your mouth healthy.
Mm-hmm. Mm-hmm.
All right. Let's do another one.